Alok Kumar Gupta. I'm a consultant neonatologist and pediatrician at Apollo Cradle, Greater Noida. Today we will talk about our topic neonatal jaundice. First, we have to know why this topic is important for the newborns. We know doctor uses the term jaundice in the newborn because of the illness of the skin of the newborn as well as the eyes of the newborn. Use the term jaundice. We have to know this jaundice is different from the adult jaundice, which is primarily infectious in origin, while this jaundice, neonatal jaundice, is non-infectious in origin. Around two-thirds of newborns have jaundice during the first week of life. Neonatal jaundice are two types. One is pathological and another is physiological. Jaundice which occurs during first day of life is pathological, which is quite serious, while jaundice which occur 24 hours onwards are usually physiological and they are usually harmless jaundice. Now we can know why this jaundice occurs in newborn only. This jaundice, it is because of immaturity of the liver of the newborn. There are extra bilirubin which are being produced in the newborn. Liver is not able to tolerate the extra bilirubin during first few days of the life. That's why this jaundice get deposited in the skin, and skin of the newborn appears yellow, as well as the eyes. Now, what are the in which case we can say the jaundice is very dangerous to the baby. Usually, the physiological jaundice is not dangerous to the baby. It occurs increase in concentration around 1 day onwards, gets peak around 3 to 5 days, then decreases on 5 days onwards, and almost abolishes from the blood of the newborn around 14 days of the age. But if jaundice appears in less than 24 hours of age, it is very severe. There are many causes of this pathological jaundice like ABO incompatibility, RH incompatibility, minor ABO incompatibility, minor blood group incompatibility. This jaundice, you need to show your doctor immediately if jaundice occurs. Then next question arises, what are the symptoms of jaundice? First symptom is obviously the illness of the skin as well as the eyes. This illness first appears in the eyes, and as the jaundice level increases, it appears in the face, then abdomen, then the lower thigh as well as the legs. When jaundice become severe, newborn become lethargic. They are not able to feed. They frequently vomit the feed. They become their arms and the legs become very tight, and their back become out. Sometimes they are abnormal movement as well. Now the question is, how can I tell my baby has jaundice? When baby appears jaundice, you can place a finger on the forehead as well as the sternum of the child for 3 seconds. Then the illness of the baby skin appears. Then you can show your contact doctor immediately. Apart from that, if there is any dangerous symptoms like baby is lethargic, is not feeding adequately, is baby is having abnormal movement, or baby arms and legs become tight, yeah, baby is arcing, then you have to show the baby to doctor immediately. Is there a test for the jaundice? Yes, there are certain tests for the babies. Like there is one invasive test and another is non-invasive test, which is done from the blood. Then this test is non-invasive test is done by the instrument known as transcutaneous bilirubin meter, also known as TCB. This TCB is accurate in the range of +2 -2. Of course, the accurate test from the blood, but is invasive, so we usually do test from the TCB machine by non-invasive way after 24 hours of life onwards. This jaundice, we follow a chart by NIC guideline, NICE guideline from the UK. We follow a chart. This chart, every 6 hours there is a certain level of bilirubin. If anytime the bilirubin increases beyond that, we intervene. We explain to the parents this baby is having jaundice, which has crossed certain threshold. Then we need to intervene. Second, we will do some blood test known as the serum bilirubin level. Both that and indirect component is quite accurate. And whenever this serum bilirubin level crosses the threshold set by the NICE guideline by UK, we intervene the baby. Uh, Now, this question arises: what? How can we prevent the jaundice in the newborn? Is there is a way we can prevent this jaundice? Yes, you can prevent the jaundice by adequately feeding the breastfeed baby. Breastfeeding the baby. If your baby is breastfeeding adequately, there are less chances of the breast milk jaundice, neonatal jaundice, as compared to formula milk baby. We have observed the baby who have frequently faced formula milk, they have more occurrence of jaundice as compared to breast milk babies. So another benefit of this baby breastfeeding is it decreases the incidence of jaundice in the baby. So another question arises: how is the jaundice treated? Jaundice gets treated by phototherapy. Phototherapy is very blue light, which is, have wavelength of around 5 to 570 nanometer of wavelength. It in it we have to put baby under the blue light. Baby we wear only diapers, and we have to cover the eye of the baby, and all the skin will be exposed to the baby. We usually prefer to use double surface phototherapy. In this means we have to put light above the baby as well as below the baby. So maximum surface of the baby is exposed to the blue light. This blue light does is it decreases the converts the bilirubin level, which is harmful, to biliverdin level, to biliverdin, which is excreted in the urine. So all the jaundice, harmful substances of jaundice converted to non-toxic component, and it decreases in the urine. So why this bilirubin level is harmful to the baby? Actually, in certain cases, this bilirubin level exceeds so much that it crosses the blood-brain barrier, and it reaches the brain of the baby, which causes the brain damage. This brain damage is irreversible, and there are many dangerous effects of this brain damage. First is the baby become mental retarded. Baby will have low IQ. They will decrease developmental milestone. Sometimes baby develop the abnormal movement known as seizures in later life. Because of this symptom, we have to strictly monitor the jaundice in the newborn baby. In our setup in Apollo Cradle, we usually discharge baby only after doing TCB level, as if we need to digest TSB level, and we follow up the baby after 48 hours in the OPD. We again check the level of jaundice visually as well as the TSB monitor. If needed digest, we also do TSB level. If any time the TSB level crosses the threshold, we counsel the parents this baby requires phototherapy. Now, there is some parents ask where sunlight is appropriate for this baby. We can expose baby to sunlight to decrease the jaundice. Answer is yes and no. First, the sunlight contains the different many wavelengths, including the phototherapy wavelength. But during winter season and during summer season, which of now, if you expose the baby in the sunlight, in this early morning sunlight, baby will become very warm. In winter, baby can become very cold. So it is not advisable to for the baby to have sunlight to decrease the phototherapy. And the effectiveness of sunlight is also low. So the baby bilirubin may keep on increasing. You do not have you will not realize that it may become very much raised beyond the level, and it can cause the brain damage as well. So if substance arises, if the baby is having the jaundice, if the baby is illness of the skin as well as the abdomen as well as thigh, immediately show a baby to a doctor. Then what are the other treatment of the for the jaundice apart from phototherapy? If this jaundice is this bilirubin is raised beyond the much phototherapy level, then we have to exchange the blood, known as double volume exchange therapy. In this, we have to substitute exchange the blood with the new blood of the baby. It's very major procedure, and we have to do in NICU. It contains very lot of time, and it's very critical procedure. In every case, we have to detect the jaundice early enough, so baby may not need to do the double volume exchange therapy, and phototherapy itself, baby can be treated. If that question arises, whatever if there is a What are the long-term effects of jaundice on the newborn? If there is physiological jaundice, yeah, pathological jaundice, we have detected early enough and which are controlled by phototherapy. There is no need of no long-term adverse effect of the children. Children will have the normal milestones, as well as the children will feed normally, and they uh, will speak normally, and there is normal motor milestone as well. So in every case, every newborn baby, if you have slightest suspicion that your baby is having yellowness of the skin as well as the eyes, immediately show the baby to a doctor and don't delay. Thank you. If there is any question you can ask me, I will happy to answer. Thank you. There's no question. Thank you. Thank you very much.